welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni there. Let's look at today's top headlines. India stands well prepared to manage the rise in COVID-19 cases. The COVID-19 pandemic has continued to pose challenges for all humankind. Currently, the pandemic in the form of BA.2 variant of the more infectious Omicron is spreading in many parts of Europe and China. As per WHO, the BA.2 subvariant of Omicron is responsible for the recent surge of new cases across the world. It is a variant of concern and is 1.5 times more transmissible than the original Omicron strain. In India, we saw a constant decline in the incidence of the infection over the past few months. However, over the last few days, the cases of the pandemic have again started increasing. As of the third week of April 2022, there has been a 90% jump in the daily cases. NEET 2022, Supreme Court denies relief to OCI candidates seeking admissions under general category. The Supreme Court division on Monday denied extending the interim relief granted to the overseas citizens of India, NEET candidates, and denied to allow them for participating in the general category of NEET counselling for the academic year 2022 and 23. Such a decision was taken by the Apex Court bench comprising of Justice Abdul Nazir and Vikram Nath after it took note of the fact that the interim relief granted by the court last year was limited only for the academic year 2020 to 21 and from 2021 to 2022. Indian Academy of Pediatrics lauds DCGI for approving COVID-19 vaccine for 5 to 12-year age group. Indian Academy of Pediatrics Twin Cities branch applauded the decision of the Drug Controller General of India, which recently approved a couple of COVID-19 vaccines for children between the ages of 5 to 12 years. India has 2 DCGI-approved COVID-19 vaccines for kids. Fortunately, these 2 vaccines are being administered to children 12 and above. 2 minor siblings dies on duty doctor allegedly thrashed by mob in Tripura. Following the death of 2 minor patients, a mob of villagers vandalized the Manikpur Primary Health Center in the Dhalai district of Tripura and allegedly thrashed on an on-duty doctor. The deceased have been identified as 8-year-old Dharmita and 5-year-old Dharmanjay. The victim has been identified as Dr. Pranab Debarma. The incident took place on Wednesday, where Dharmita and Dharmanjay were suffering from high fever and were admitted to the hospital. It has been claimed by the family members of the deceased that both the children were given medicines from the hospital and after consuming the pill, they both died within a few hours. As per media sources, it was later found that both the deceased children were suffering from malaria. Angered by the situation, the mob of villagers went to the hospital and thrashed the doctor. As a result, the doctor is in critical situation as he suffers serious head injuries as well as other parts of the body. Hearing the news, the local MLA rushed to the spot and calmed things down. The mob of villagers assaulted the doctor again and again as soon as MLA left from there. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.